Today is April 16th, 2013. This is Rihanna Nicole Smith's speech. And you may now begin.
Less than 38% of the United States population is eligible to donate blood, which keeps us in a constant state of needing blood. We need an alternative when performing surgery to conserve our blood for emergencies such as for trauma victims and military soldiers. Bloodless surgery programs were first installed in the 1980s, yet most of society is unfamiliar with the techniques and the methods. Bloodless surgery refers to the strategies for medical care without allogenic blood transfusion and blood management. Bloodless surgery is on the rise across the map and is one of the best medical practices used in the surgical field in today's day and age. Therefore, I want to share my knowledge of bloodless surgery in discussing the methods, benefits, and the personal gain you get from it. We're going to talk about how does bloodless surgery work, why choose bloodless surgery over traditional surgery, what are the benefits, and what do you gain from using this surgery. Okay. There's a method to every madness, and so we're going to start with methods. First, you have preoperative management, which of course is before surgery, intraoperative management, which is during surgery, and you have postoperative management, which is after surgery. So, preoperative management is all about reducing the risk of allogenic blood transfusion. So to do that, you're going to enhance hemoglobin levels by using iron supplements and erythropoietin, or also called EPO, which is a human hormone that stimulates the production of red blood cells. And then your medical staff is going to restrict the number of blood tests performed and the volume of blood taken from your patients. And also stop any medication such as aspirin that thins your bloods out and affects clotting during surgery. Then you have intraoperative management, which is all about controlling your blood loss. You have hemodilution, which consists of taking several units of the patient's blood, and it's drained into a closed system, and then you're filled back up with crystalloids and colloids, which it's just pushed into your tissue, and it maintains the oxygen. It maintains oxygen transport that you need. You lose less red blood cells because your blood is diluted when they do this. And after the surgery, they'll just give you the blood that they took from you and return it back to your body. Then you have analogous blood cell salvation, which is a device that returns any lost blood from the surgical site back to your body. It's called a cell saver, which is the device, and it just returns all your blood back to you. And then you have hemostatic surgical devices, such as electrocautery, which helps prevent your blood loss. And what the electrocautery does is it produces a stream of argon gas, which coagulates the vessels and minimizes tissue trauma. And then you also have a harmonic scalpel that just causes blood to clot after the tissue is cut. Now moving on, the last one is post-operative management, which is all about just maintaining your blood volume after the surgery. And all that's really required is the nurses need to keep watch of their patients real closely, watch their hemoglobin level. If it drops, that just means that there's internal bleeding and they need to find the source. Also, again, you have the EPO therapy, giving the hormone back to you, and also iron therapy, which boosts oxygen transportation. And then, according to Goodnow, Shander, and Spence, other post-operative methods are avoidance of hypertension, restricted phlebotomy, and manage anticoagulants and antiplatelets. Now, moving on, the benefits of bloodless technique are enough that should convince anyone to use bloodless surgery. Benefits would be you have lower risk of post-operative infections. You stay at the hospital shorter. I think it's by about 3 or 4 days. You heal faster, and it eliminates all risk of catching a blood disease that are found still in donated blood to this day. Not all blood is tested when it's donated. And it also avoids a negative immune response if your body doesn't accept the blood that is given to you, so that you don't go into anaphylactic shock, things like that. Now, personal gain is anything an individual feels she has benefited from. Therefore, a person has quite a bit to gain by doing a bloodless surgery. Now, take in mind that with bloodless surgery, it opens the doors for Jehovah's Witnesses to have surgeries that need to be done because they don't accept, their religion refuses them to accept blood products from any other human. So for Jehovah's Witnesses, they get to live a longer life because they have the option of choosing this surgery now. Also, just people have their own choice. A lot of people, it's about having a peace of mind for others who don't want a blood transfusion, scared of catching a disease or, you know, their body responding horribly to the blood transfusion. So it just gives that person a peace of mind when they walk into the surgery room. Also, the money you save is tremendous. You know, the cost of blood is about $1,500 a unit after you add all cost in. And on average, people get 3 to 4 units of blood when in surgery. So an average bloodless heart surgery is about $16,345. And a blood transfusion surgery is $23,415. That's a difference of $7,100 that you keep in your pocket just by doing a bloodless surgery. You know, personal choice and money are important to us and in our lives, so we should just choose bloodless surgery to keep these things. Now moving on, only a handful of facilities have formal blood programs in the 1990s, and now there are over 80 facilities across the country. It's growing and is one of the best medical practices available today. And I'm helping expand the bloodless program by discussing the methods, benefits, and personal gains each individual receives from bloodless surgery. Blood is not benign. There can be several consequences to using bloodless surgery, to having blood transfusion surgery. An estimated 13 million of blood are not tested for HIV and hepatitis. Bloodless surgery gives us an opportunity to embark on a new way of thinking about providing patient care and renewing our commitment to our patients' rights.